3 different injectable techniques that you can learn today on how to treat these stubborn accordion lines or wrinkles in the mid-face. Let's get into it. By the way, my name is Julien. I'm a nurse practitioner. My clinic is located here in Ottawa, Canada. That's my clinic, and I've partnered with most of the greats in the industry, and I'm considered an expert in injectables. If you're serious about medical aesthetics and you want to grow your brand or your clinic, be sure to reach out to me on Patreon. I'm here to help. So before we get into how we treat this, let's find out first of all what causes those wrinkles. They are the result of a combination of things. First of all, the risorius muscle, which is the primary muscle of the smile, pulls back and folds the skin here constantly. Now, that isn't an issue unless you've lost volume there, such as your buccal fat, and you've lost elastin, collagen, and sometimes even hyaluronic acid, which tends to happen over time and doubles in severity if you're not protecting yourself with SPF. So remember that. Now that we know that, let's get into it. So we've already covered the anatomy of cause. Let's go over the anatomy of risk. And basically the major risk here is this facial artery that runs along the side of the face. It starts from the facial notch right here. You can actually clench, feel in front of the masseter. You're going to feel a notch on the bone. And that notch is the facial artery that's actually pulsating and pounding directly into the bone, causing an indentation. From here to here, it becomes very deep. And then once it runs from the iris to the nose, it transitions into superficial. Now, that deep to superficial is somewhat important. However, if we are using a cannula and we are avoiding nicking that artery altogether, that's going to save us a lot of issues and a lot of headaches. So rule number 1, for this treatment, one option you can use is going to be a cannula. And if you're not sure what the difference is between a needle and a cannula, let me explain with the use of this pen. Here is an example of a needle, sharper tip. Here's the example of a cannula, a blunt tip. We would take the needle to pierce through the skin, then we'd swap it to a cannula where we'd insert into the skin using that opening, and we'd be able to fan product wherever we'd like without piercing any vessels. This can be considered a safer and effective tool when we're dealing with injectables. Option number 1 is by simply restoring the area of concern with hyaluronic acid. So let's bring in Sarah and show you what I'm talking about here. Let's say that these lines are the result of a loss of volume here. So what I'll do is I'm going to make my entrance point here, swap it for a cannula, and retrograde strands of a mid-G' hyaluronic acid in this area to create a really nice natural restoration of that lost volume. The benefits of hyaluronic acid filler are that it's reversible. So if you don't like it or if there's a medical emergency, you always have that luxury of dissolving and removing it. The downside is that it tends to migrate at times. So whether it's 2 weeks later or maybe 6 months later, you might notice that it might move around. The other risk with hyaluronic acid filler is that it doesn't fully break down over a year or two. It tends to stick around and integrates into the tissues, which can be great if used in mild to a moderate amount of quantity. But over time, I tend to recommend people only using maybe 2 or 3 rounds of that maximum over a 3 or 4 year period. And then I eventually encourage them to use other modalities such as biostimulators or energy devices. Option number 2 is by taking your favorite collagen stimulator or biostimulator such as Radiesse, Sculptra, or EasyGel and coat the entire area of the face here, such as what we did for this example with Sarah. And the reason why people like this is because by not targeting one specific area, it gives you a more generalized restoration. It looks completely natural, and we lose elastin and collagen in all of these areas anyways. So people get more than just one benefit. It does take maybe a couple treatments, maybe even 3 for certain people, but it's a slow restoration. The collagen that's being restored is gradual and very natural. And if you're wondering what some of the pattern techniques that I use, here's an example of one where I do my entrance points here with my needles, and I take my cannula and I coat these entire regions using this method here. If you want more information on that, make sure you check out my Patreon. And option number 3 is where we do not address any of the lost volume. However, we attack the lines directly using hyaluronic acid dermal filler. So this technique is completely different from what we were talking about prior. Up until now, we were talking about the loss of volume restoration using hyaluronic acid or biostimulators. What this is doing is a little different. I am taking a very minute amount of hyaluronic acid and strategically placing it into the skin in order to create a scaffolding. Let's get into that a little bit more. So there are two techniques that we use in order to prevent the skin from bending or folding. And the first one is one that I created called the bidermal plane technique. And what we're doing here is by taking a very small needle and a very thin product, I go directly into the skin and I place a thin amount of product and I massage it out. This prevents the skin from folding and it doesn't add any additional volume. And the second technique, which was invented by a friend and colleague of mine, Dr. Tom Van Eyck, is the Ferning Technique. And the Ferning Technique is essentially explained as this. Let's pretend that this is a leaf and this is the stem of a leaf. So we have a leaf that goes around here. The way he views it is by taking product and making little struts away, in and away from the fold. And he does that on both sides. And how that works is that it creates tension here and it prevents the fold. Different yet similar outcomes, both using very tiny amounts of product to the point where it doesn't add any additional volume. And it's a great way to soften these lines with or without the combination of your favorite biostimulator. And just like that, 3 different ways to treat those stubborn accordion lines. Until the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Cheers, guys.